We're all set? So, hey, here we are again, the Ben and Gary Show, We Know Dentistry, and we have our special guest, Dr. Dan Pinto. He's our new associate at the office, and we're excited to have him, and we just want to let him get a chance to get to know you. But in the meantime, we're going to answer a question here, and we have a question from our audience that simply says, do I need to floss? I'll leave that just there. Question. It seems like a simple question. And there's some information out there that has been published. I think there was a New York Times article a couple of years ago that said something about that flossing, the benefits of it were overrated. Yeah. What do you guys think about that? How does that leave you when you read something like that?
Well, I was looking at it, and it seemed like that they were kind of just looking at articles. And they weren't really dentists looking through them, and
lay people trying to
decipher, because a lot of those papers, they have technical terms, and and I think the most important thing is to see the peer reviewed and dentist evaluated articles and seeing how they respond to the information and the conclusions that they can draw from that. So I think that's more important than just having an article that's posted online.
Right.
Yeah. When I was in dental school, I remember one of my instructors in school saying to me that he asked me if I floss. I said, "Well, this is my first year, so I wasn't properly trained.
You weren't savvy enough there to get the proper answer."
Yeah. So I said, "Well, sometimes." He goes, "Oh, okay. Well, Gary, just floss the ones you want to keep."
Right.
I was like, and that stuck with me. That made a big impression on me. I was like, "Well, I want to keep all of them." So, but I was more diligent about it after that.
It does take some more time, in your daily routine. So I can understand, everyone's sort of lament to want to take that time. I mean, most people don't take enough time to brush their teeth. Let alone floss.
Right.
And maybe in that sense, not in that order. To me, it seems like you need to floss to get the stuff that's out in between, and then you brush it away.
Right. Yeah, that's where I feel like the research wouldn't really matter either way. But I think the important thing is the flossing itself, right? But,
I do think that's the case.
At least the flossing is at least doing.
Well, what does flossing actually do? Right.
Right. What does it do here?
Right. What's the whole purpose of it?
Well, I mean, my opinion of it, there's areas between your teeth that your toothbrush is just not going to get to, and so those are areas that are more likely to, if that builds up, it's going to lead to some inflammation of the gingival, of the gum tissues, and if that plaque is allowed to be able to stay there long enough, the facts are plaque does eventually give off a byproduct that's acidic, that does melt a tooth away or soften it. So if you want to leave that between your teeth because you don't floss, then in my opinion, you're kind of rolling the dice on whether or not you're going to get some tooth decay, in between the teeth. And that is the number one sort of cavity that you're going to fill past a certain, junior age. And, is a filling that's going to incorporate, a side of the tooth, not just the top. And usually it's in between.
Right where the floss goes.
Right where the floss goes.
Right.
I guess the great point about it is just like, which teeth do you want to, do you need to floss, or the ones that you want to keep? I think most people want to keep all of their teeth, so I guess you can probably roll the dice and not floss, but I mean, I think you're taking a big risk, you're going to take a big risk of either losing teeth, but probably not before you lose teeth. You're going to lose time actually sitting in the dental office with, getting work done, and there's a cost involved in that, and a little bit of floss can prevent a lot of cost.
Right.
I think. Right. I like that, by the way. Yeah. No pun intended.
Well, especially with the research showing the connections between other health issues.
Right.
Because of the plaque and bacteria that gets into the bloodstream.
Sure.
Right? So.
And if you have inflammation, which means that you're going to cause some sort of redness, swelling, bleeding, the way in which you get into the bloodstream is going to be through that portal. So if it's unhealthy, it's far more likely for it to be able to get into the system. And if it's nice and tight and doesn't bleed, it's far more like a barrier between what's in your mouth to what they can get in your system.
Right.
And a lot of the toothbrush companies, they claim that the toothbrush, the electric toothbrushes can get in between the teeth, sonic vibrations.
It's a great point, yeah.
But I don't know how effective that sonic vibration is compared to like a mechanical physical removal of the plaque. So that's something that is unsure there too.
You know, there's a lot of different ways that, you know, I think the companies understand that people don't like to floss, and so how can we make this easier?
They're trying to make
it
easier. But I don't think it replaces the actual.
You know, a lot of patients will come to us and tell us, you know, hey, the water pick, I do that, I don't floss. You know, well, I think the facts is that, you know, plaque is what's sticky. You can't just, you know, take a fast jet of water and blast it off. It is effective in other ways. It can stimulate the gum tissue. You can, you know, loosen up debris that's just sort of free and loose. But plaque has no effect. You know? And but there are patients who, you know, for that, getting off a little subject here in terms of flossing, but the water pick isn't necessarily a bad thing. Are implant patients, you know, have these sort of teeth replacements, called restorations, that will be sitting on dental implants that it's just completely attached to your jaw differently than your natural teeth. And so getting up under that, you know, with something with a toothbrush is really not possible. So, you know, you're not worried about tooth decay when it comes to titanium and porcelain, i.e. dental implants. But you know, so you want to get the free sort of just debris that's there, you know, out. You know,
minimize the gum inflammation.
Correct.
And then to follow up on that, of course, implants are usually on patients that are a little bit older, and we have older patients that don't have the mechanical skills that, you know, that are you need to floss. And so there are aids that you know, the little yoke, the plastic thing that has the floss in it.
The super floss.
Yep. And then also, I know some of our hygienists recommend the go-betweens. They're little brushes that will fit. They're different sizes, but find the one that
exactly. Little Christmas tree brushes that you can kind of go in between areas.
And that would, you know, certainly help remove plaque. It doesn't remove calculus, the hard deposits, but
I think the public knows it as tartar. You know, we say calculus. You know, when we get all technical, you know, it's you know, we don't want to.
That's math stuff.
Math exactly here. So you know, we got to use our tartar.
But I would encourage our listeners to talk to their hygienist or dentist, and you know, if you have problem areas, there are other ways that we can advise you to clean those areas in between.
Yeah, because the name of the game is just general oral health. You know, and we know that the plaque and the bacteria leads to the lack thereof. And by removing it, you can return your mouth to health. You know, so whichever product that gets you there, it effectively is what we should use. Now, a lot of times the public doesn't necessarily have the information that we have to know that a water flosser or a water pick, you know, is not the same thing. It's not the same thing as there's no replacement for the floss or actually being able to remove that debris and that bacteria.
Just to use an analogy, like think of like a dirty dish. You know, that the stuff's been sitting on there a couple of days. You know,
great point.
Hopefully not a couple of days. But you know, you shoot it with some water, it's not going to go off. You really have to take like the sponge or the metal or whatever kind of thing and actually like scrape it off and rub it down and make sure that it's gone.
I know
you can't get that with the water pick.
A lot of people put their dishes, you know, completely dirty in the dishwasher and let it sit, turn it on, and expect them to be clean, and wonder why they're not when they come out.
It's the exact same concept.
It's the exact same concept, you know. So there's a little detergent there, swishing it around isn't going to get into all those, you know, areas and those small spots. And you're just leaving it behind. And if you think you're getting it here and not really, then, you know, you're getting a little false sense of security. And wonder why when we tell you that things aren't so great, and wonder how that happened. Well, you know, you got to look in the mirror and understand what your technique is. You know, so you know, looking to that point here, I think you should just. There's another reason to get to the dentist, get to the hygienist, so that you're evaluating it properly. Because
maybe you don't know how to floss. You know, that's the other thing.
Whole another subject.
That's
is that the flossing seems to be very intuitive, but I have to tell you, most people. Not bashing anybody. It's just simply it's a technique to it, you know. And usually the floss packages don't come with directions. So that's what we're for. Well, I think we kind of hit that subject.
I think so. Sure.
I think we'll see you next time. Great question. Love that one. Looking for your next one. Ben and Gary Show. Dan Pinto. We'll see you next time.
Bye.
Bye-bye.